Welcome to this product demonstration video for the UK Drug Testing and ValueMed websites, demonstrating for you the Dextromethorphan test strip. Now, Dextromethorphan is the common constituent element in cough and cold remedies, and in low doses it's very safe and can be used and administered quite safely. But as it is a stimulant, it has got into the illicit and abuse realm of common use, and in high doses it can certainly potentiate other drugs and cause some issues. So the need for a test strip. These are coming to us currently in all test branded foils. Dextromethorphan DXM20. The catalogue reference number is DDXM101, which indicates a test strip. That is the lot number for this particular batch and the expiry date when we are filming this demonstration video. This is the actual test strip which I've run previously to show you how to interpret the test results. This test is intended for use in normal human urine and is dipped just to below the maximum dip line indicated on the test strip for between 5 and 15 seconds until you start seeing a pink dye running up the mid flat section of the test strip here. This test strip has completed its run and has both a control line which forms nearest the DXM coding on the handle and a test line indicating that no dextromethorphan has been indicated or detected within this test strip as I've run it on that liquid. They're incredibly accurate, easy to use, and usually will give you a full negative result in as little as 2 to 3 minutes. The importance of screening for this drug is where it has been or is suspected to have been taken in high doses as part of a drug addiction or abuse case, and its presence at over the cutoff levels for the test strip indicate that that is probably the case. But you may get positive indicators where the cough medicine or cold remedy has been taken routinely in the normal prescribed or recommended doses. So if you get a non-negative result on this and there is no consumption history or a consumption history that you are suspicious of, and it may be being taken to cover up an underlying abuse of dextromethorphan, then we recommend moving to a laboratory confirmation test to determine the absolute levels of the drug in the urine sample and make sure that they are consistent or inconsistent with normal prescribed or over-the-counter use of the proprietary product. I hope you found this demonstration video helpful. If you have any further questions regarding this drug group or testing for it, then please contact our customer service support team either through the live chat on the website or through the telephone number provided. Thanks very much for watching.